Even if you're taking steps to manage your type 2 diabetes, there may come a time when your treatment plan no longer works as well as it once did. That's because type 2 diabetes is a progressive condition, meaning it changes and usually becomes more complex to manage over time. As it progresses, your body may make less insulin or become more resistant to the insulin it does produce, so you may need to adjust your treatment. For example, if oral medication and lifestyle changes are no longer working to manage your diabetes, you may need to add a non-insulin injectable or insulin to your treatment plan. Diabetes is very complex, and everybody's diabetes is different, notes Jeremy Beaulieu, a nurse practitioner and certified diabetes care and education specialist, CDCES, at Joslin Diabetes Center in Boston. There's no one-size-fits-all approach to diabetes management. Here are some questions to ask your doctor if you think you need to ramp up your treatment plan. 1. Why isn't my type 2 diabetes treatment plan working as well as it used to? Many people with diabetes think they need to explore new treatments because what they're currently doing isn't working, and that's true, Beaulieu says. For example, you may notice that your blood sugar, glucose, or A1C levels are rising, even though you eat a healthy diet, exercise frequently, and stick to your doctor-prescribed treatment. This could be because your type 2 diabetes is progressing, you've developed a health complication related to your diabetes, or another medication you're taking is interfering with your diabetes treatment, among other potential causes. If you make more diet modifications and exercise more than ever and your A1C continues to rise, it might be time to talk to your doctor about a change. 2. Why might I need to include injectable medication in my treatment plan? Many people with type 2 diabetes manage their symptoms by eating a healthy diet and being more physically active, according to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. But some people with the condition also need medication. That will usually depend on how well your blood sugar or A1C levels are being controlled, says M. James Leonard, 1500, an endocrinologist and the medical director of Christiana Care Health System's Diabetes and Metabolic Diseases Center in Wilmington, Delaware. If diet and exercise no longer help you maintain healthy blood sugar levels or hit your A1C target, your doctor may start you on an oral medication, pills. In time, you may need to change your medication, add medication, or take medicine you inject under your skin, including insulin or non-insulin injectables, to help control your blood sugar. Even if you don't take insulin normally, you may need it at certain times, such as while you're pregnant or if you're in the hospital with another health problem, the NIDDK says. 3. What types of injectable medications are available for type 2 diabetes? Injectable medications for type 2 diabetes include non-insulin drugs and insulin, a synthetic form of the hormone produced by the pancreas that helps move glucose into your cells, where it's used for energy, the NIDDK says. Injectable insulin helps control blood sugar levels in people whose bodies can't produce enough insulin naturally. The drug lowers glucose levels by increasing the uptake of glucose in your muscle and fatty tissue and slowing the release of glucose from the liver, according to the Cleveland Clinic. There are several types of prescription insulin products available, and each differs on how quickly it starts to work, when it peaks, and how long it remains effective, the Cleveland Clinic notes. You may inject insulin in your abdomen, legs, back of your arms, or buttocks. Inhaled insulin and insulin pumps are also available. In addition, there are several non-insulin injectable diabetes drugs available, according to the Cleveland Clinic. These are designed to keep food in your stomach longer and increase your body's production of insulin when you eat, while lowering the amount of blood sugar or glucose released by your liver. Your doctor should work with you to identify the right insulin or non-insulin injectable medication for your diabetes, the Cleveland Clinic notes. 4. If I have to take insulin or another injectable, does it mean I've failed at managing my type 2 diabetes? Needing to take insulin or another injectable medication to help manage diabetes does not mean you failed. Although some people with type 2 diabetes could eat better or exercise more, or be more disciplined about taking their prescribed oral drug treatment, the condition is a progressive genetic disorder, meaning that often, as you age, your pancreas makes less insulin, Dr. Leonard explains. Maintaining a healthy weight and staying active only slow the process. They don't stop it. For many people with type 2 diabetes, moving to insulin or another injectable is a necessary response to a constantly evolving condition. That doesn't mean you should give up on your healthy lifestyle habits though. 5. I'm scared of needles. How can I make injections easier? Many people fear needles, and some type 2 diabetes medications have been developed with that in mind, says Beaulieu. With some of the non-insulin injectables, for example, you don't even see the needle. You just place a pen-shaped device on your abdomen and push a button, he explains. The mechanism injects the drug, and then you take it off and throw it away. The whole process takes about a minute. Other injectables use very small needles, about 2 to 3 millimeters long, designed to deliver the medication just beneath the skin, he adds. Talking to your doctor or a CDCES about your concerns can also help, according to Beaulieu. I have found that teaching a person with type 2 diabetes how to administer an injectable in person and walking them through it reduces a lot of the anxiety associated with it, he says. Once someone has done it, sees that it doesn't really hurt and is pretty easy to do, they generally don't have any problems. 6. Will I need to continue taking other diabetes medication, such as pills? For most people with type 2 diabetes, metformin, which comes in pill form, is the oral drug they'll take, at least to start. Metformin is designed to regulate the amount of blood sugar released by your liver, but it doesn't help your body produce more insulin, according to Kaiser Permanente. That's why your doctor may keep you on your oral medication as you transition to an injectable, Leonard notes. This is called combination therapy. Eventually, you may stop the oral drugs and use only injectables, depending on how well your body produces insulin, Kaiser Permanente says. 7. How will I know if my new treatment is working? You'll know your new medication is working if your A1C numbers shift down toward the goal number set by you and your doctor, usually 7% for most adults, according to Leonard. Conversely, you'll know it isn't working if your A1C numbers remain high. An A1C test measures your average blood sugar levels over 2 to 3 months. You should see your doctor every 3 to 4 months to get your A1C, blood pressure, blood sugar, and cholesterol levels checked and, if needed, reevaluate your treatment plan, Leonard says. It's important to note that A1C tests give an average level over several weeks or months, which is why you should perform at-home blood sugar tests as prescribed by your doctor to see how the medications affect your levels on a day-to-day basis, he adds. 8. Do I need to adjust my diet and exercise plan too? Maybe, says Beaulieu. Chances are, if you're eating a healthy diet for type 2 diabetes and exercising regularly but you're no longer able to achieve your target blood sugar or A1C levels, no amount of diet changes or additional exercise will help. You'll still need to start on drug treatment, he notes. But a tweak to your lifestyle choices can help your new treatment start working faster and more effectively overall, he adds, noting, a good diet and getting enough exercise will always form the base of diabetes management, and it doesn't hurt to re-examine what you're doing if it doesn't seem to be working. Talk to your doctor or a certified diabetes educator about lifestyle changes that may help make your treatment more effective. 9. Might I need to change my treatment plan again in the future? It's possible. As we said before, type 2 diabetes is progressive, meaning it worsens over time. That's why you need to monitor your blood sugar and A1C regularly to make sure your treatment plan is working, Leonard notes. If your doctor recommends a change, the first approach you try may not work, Beaulieu adds. Some people will respond better to one class of medications than another due to underlying genetic variation, while some respond better to changes in their diet, and some respond better to exercise than others, he says. Plus, as people get older, we like their A1C to be a little bit higher, usually 8% or less, especially if they are on medications that can cause low blood sugar levels or insulin, says Beaulieu. The tighter control you have as someone gets older, the more they run the risk of having low blood sugar levels, which puts a strain on the body and, in an older adult, can be very dangerous and lead to falls, which can lead to fractures.